So Visualase is a very innovative new technology that we've pioneered here in HCA for the UK. It's a technology that allows us to, using a very minimally invasive fibre optic catheter through a single stab incision, treat an abnormality within the brain, such as a tumour or an area of epilepsy, without having to resort to open surgery. So it avoids many of the risks of open surgery, many of the inconveniences of open surgery, but also allows us to access tumours and locations that would have previously been considered unreachable or untreatable. So it's really opened up a whole new area of treatment options for patients who had no option previously. So the way that we use Visualase is that we produce a very precise 3D reconstruction of the patient's brain. And then using computerized software and a robot, we guide very precisely down to the area of abnormality a single fibre optic catheter, so very thin, very minute indeed. And then using a laser, we monitor the temperature in the area of abnormality in real time. So we heat up the tumour, let's say, using the laser in real time, killing the tumour, but at the same time, constantly monitoring the temperature within the brain and the tumour using MRI technology to make sure it's safe, so that we're actually removing the tumour from the inside out without having to do an open incision. And that allows us to treat these tumours that are previously unreachable. So it's still, Visualase is still a form of surgery, and it still requires us to place a catheter down inside the brain. Now, whilst we do that with a great deal of precision and a great deal of thought, there is still a theoretical risk, a small risk, let's say, of infection or bleeding or of producing a stroke from introducing the catheter down. But that is greatly minimized by the use of planning software, by the use of robotic guidance, experienced surgeons, and also by the sheer small size of the catheter that we use. It literally is not much thicker than a human hair. So when it goes down, it's very small indeed to minimize that risk. So I think there are two aspects to Visualase when we compare it to conventional surgical techniques. The first is that it allows us to reach tumours that previously would have been considered unreachable because of their location, particularly their depth within the brain, or perhaps their relationship to important structures in the brain. So that's one aspect. The second aspect is that it's very, very minimally invasive. So the incision that we insert the Visualase device through is literally a single stitch. So there's no head shaving required, the incision is invisible, and the patient at most will require to stay in hospital for one night. So it's tumours that couldn't have been treated before, combined with much less impact on the patient's well-being compared to open surgical techniques. So it's quite revolutionary in that way. So I think that there's no doubt that, to my mind, as a neurosurgeon who's been specialising in brain tumours for over 20 years, Visualase is really the most exciting technology that I've worked with. And even I, when I did the first few cases, was shocked by how well the patient was after the operation. I couldn't tell the patient that had an operation, and we were accessing tumours that we would, and any surgeon would have considered previously inaccessible. So I think it's really opening up a very exciting area where we can now offer surgery to patients who previously had no options, and also we're able to absolutely minimize the side effects of surgery and the side effects of surgery. So no head shaving, tiny cut, staying one night in hospital and effectively just walking out of hospital the next day, and nobody's any the wiser that you've had treatment.